My name is Diaz, and I would like to speak to you today about the need for adolescent and young adult-centered care and how they can be run effectively. I want to start by acknowledging that the healthcare system in the U.S. was created by adults for adults. And then we try to fit young people into that system, and when it doesn't work, we call them non-compliant and hard to reach. When indeed what is hard to reach is the system itself, the way those services are designed. Adolescence and young adulthood are really critical stages where the responsibility for healthy behaviors starts shifting from the caregivers to the young people themselves. It is a stage when people are becoming more independent. There is a lot of experimentation, and experimentation is not bad. You know, young people need to experiment and try new things in order to really gain the skills to be able to be independent. And what we need to do as adults is really create an environment where young people can experiment, try things, learn in an environment where they are not going to get into difficulties. So that's really, really important. And the behavior of young people affect their health status during adolescence and during young adulthood, but also establish their health status over the life course. So if you are not healthy as an adolescent, if you get engaged in behavior that are not particularly healthy, that is really going to affect your health as an adult. It is really, really important for providers to really encourage young people to engage in healthy behaviors, to modify their behaviors, to become great healthcare consumers. And when you provide services in a way that is adolescent-friendly and youth-friendly in general, the young people are much more likely to change their behaviors. So we really can have a tremendous influence in that age group. At the Mount Sinai Adolescent Health Center, we serve over 10,000 young people ages 10 to 24 every year, and their children, if they have children. We welcome all young people within our age range of 10 to 24, but we cater to low-income, disadvantaged, disconnected young people because we know that they do not have access to care. The young people that we serve, 98% of them are low income. Some of those young people have loving families. They are going to go to school. They aspire to go to college. They get in for work. And some of them are homeless. Some of them are in foster care. Some of them are being sex trafficked. Some are refugees. And the beauty is that they all feel comfortable coming to our center. No one knows why they are coming because the program has no stigma. It is not a program for family planning or HIV or substance, it's just a teen center. And they all feel very comfortable coming, and all 10,000 of them sit next to each other in the waiting room, and it's only behind closed door that we find out what they're there for. Something that is really important, we always take care of whatever the issue that brought them in. In addition to having all these services under one roof, we also know that it is important to provide as many services as possible during one visit. So the young person, when they come to see me, I will do their history and physical exam. I will connect them to the health educator so they learn more about their body and decide on family planning if they need that. I will have the mental health person see them if I discover that they are depressed or could benefit from that. So if it's an acne, we take that very seriously. We make sure we treat their acne, but then we ask them all these questions to get a sense of how they are feeling, their type of behaviors, the type of family relationship that they have. And for example, if we identify that they are depressed or they have a need for mental health, we provide that there. So we have really all these services integrated: physical health, sexual and reproductive health, dental, optical, behavioral and mental health. From dental to mental, from head to toe, everything. And the more that you can have under one roof, the better it is. And it's not just about being co-located, it's really about being integrated. All these people working together. And the young person will know that it is a team taking care of them. You know, over the years, people come from around the globe to see the way we work at the Mount Sinai Adolescent Health Center. And they often ask, why are 10,000 young people coming to you every year? They come to you asking for help. What is it that you do? What is it that you are giving them? They are making line before 8 in the morning, usually, to get health care. So with the support from the New York State Health Foundation, we created a blueprint about our philosophy and our approach. And this blueprint really gives a roadmap of how people who are interested in either adapting or replicating our services or modifying what they are doing can find it in this blueprint. So this particular blueprint was designed to be used by people depending on their context, depending on their needs, depending on their resources, depending on what they want to do. You can use any of the principles that we have there and shape it to your context and what is, allowable, what is doable for you in your context. And in addition to that learning that we are doing as we serve them, in our program it's also very important to us to have the voice of young people. So they really inform formally, like we have advisory board of youth, we do surveys of them, asking them what is working for them in the program, what's not working, what else would they like to see. So the whole work that we do, everything that we do, is informed and shaped by the need and the voice and the desire of young people. So they're our partners in the work. We are not serving them. Our approach is that we want to empower them, but we work in partnership. And everything that we do is informed by them and what they need and what they would like to see. Hi, my name is Angela Diaz, and I would like to talk with you about why it's so important to have an adolescent and young adult-friendly culture in your healthcare systems. When people hear the word culture, they usually think about place of origin, language, and things like that. But after working around the globe with youth, with young people, I really have come to understand that there is a culture of adolescence. And the lives that they live today are very complex, and there is tremendous stress in many of their lives. So we really need to understand and appreciate that when we work with them. And we need to help them feel comfortable. We need for them to feel that we are not judging them, that we are there really to try to help them, that we are in this together, in whatever it is that they want to achieve. We are trying to facilitate that process in the context of their development. So it's very important to understand the culture of adolescence. The research also shows that when you provide services in a way that is team-friendly, that increases the use by young people of your services. They come, much more likely to come when you provide team-friendly services. The Mount Sinai Adolescent Health Center is a learning organization. We are never static. We are around for 50 years and we are always evolving, always changing based on the needs of young people or what they tell us or what is happening in the environment that affects them. For example, when we began, we were not working with transgender. We had kids who were gay, lesbian, bisexual, questioning youth. But now that there are many young people that have come out saying, that because they are transgender, so now we have a program about transgender youth. So we have to learn how to work with them. We have to learn about their needs. We have to learn how to work with the parents. And then now we are really have tremendous expertise in that area. The young people make our program. We are about them. But the other very important piece is the staff. So we can teach them the content on how to work with the young people, but they really have to be passionate. They have to understand that population, that we are there to serve them. That is really, really key. The other thing that I think is important for young people is to see themselves reflected in the staff. So we try to really have a very diverse staff, not just in terms of race, ethnicity, language, but also we have staff who are gay, who are lesbian, who are transgender. We have staff with disabilities. We have staff that really almost any young person coming to us can see themselves in that person. And the reason that I think is so important is because a young person can look at themselves in that staff and see possibilities for them. It's not just about the connection and getting the services, but they see, I can be a social worker, I can be a doctor, I can be a health educator, because a person that looks just like them is. And sometimes they had not had those life experiences before. At the Mount Sinai Adolescent Health Center, we have like 17 different disciplines. You know, as a physician, I'm an adolescent medicine person, I'm not able to meet all of their needs. We need all these people with different expertise to work together as a team. And it's not enough just to have multiple disciplines. The services have to be delivered interdisciplinary. People have to work together around the young person. And even when we do the treatment plan, we bring all the different disciplines and then we work together. And for certain group of young people that we know have very complex needs, the staff meet regularly and discuss the cases and do treatment plan together. It's really, really important to do that. Since we provide services from age 10 to 24, around age 22 or so, we start working with young people about transition. We tell them that when they turn 24, they will age out of our services and that they will need to go to an adult system, hopefully a medical home. So at age 22, we start working with them to prepare them for that transition. And as we get closer, we make sure, for example, if they need a physical, they get their physical. If they need an IUD, they get their IUD. If they need immunization, we just make sure they get everything that they need. And then we help them connect to an adult system. And often they want to keep coming back, but we encourage them to stay there. And we just don't say, oh, you age out. We actually find places and connect them to those places, help them make the appointment to make it easier for them, and give everything to them in writing also, just to facilitate that transition. Because it's not so easy to transition for young people. Hi, my name is Angela Diaz, and I would like to talk today about why it's so important to integrate medical and mental health services. Research shows that only 20% of adolescents and 10% of young adults that have a mental health needs get services. So there is a tremendous scarcity of mental health services. Developmentally, young people do not necessarily know how to label their needs. They may be depressed, but they may not know that they are depressed. So it is very important to integrate services and to work the way that we work with them, because by us asking and screening them for different things, then we find out that they need mental health. And we are right there working with the medical people and the mental health people, so that person can benefit from that. Having the integrated primary care and mental health services really remove barriers. It is hard for any person, including adult, to be going to different places, different sites for different type of services. There are issues about transportation, geography, learning the different policies of the different systems, learning that they have to show up at this time or that time. So really these integrated services make it easier for the young person to be able to get all those services that they need. When you are doing intake, let's say for mental health, in many places, people have this really rigorous process and assessment, that they have to take all this information. And sometimes when people spend all that time trying to gather the information, the young person feel that they are not paying attention to them, they're not being engaged. And when you work with teenagers, the number one thing is engaging them. So you really need to balance the needs to collect whatever information you have to collect, but at the same time, keeping in mind and making sure that that young person is really and truly engaged and feel that they are the most important thing right now for you, that you're paying attention to them. Because the purpose of the first visit is to get a second visit, and then a third, and then a fourth. You really want to engage the young person. So whatever you need to do to achieve that, that's what you need to do. And maybe the form can be completed in multiple visits or something like that. I also work with young people who are homeless, who are being sex trafficked. And when I know that it will be hard for these young people to necessarily come regularly. So we have to, or to come back, if they go to a place that they say, you need an appointment for mental health. We know that these young people, it's really, really hard for them to return. So we need to give them as many services as possible, and they will see that mental health person right then and there. And the mental health person has to be very flexible. Not only in terms of balancing whatever information they need with trying to engage the young person, but also understanding that that young person is not necessarily going to come back on a regular basis, that they may come back sporadically, that they may come back for medical services, and then they will need to see them then. All those things are really important. Hi, my name is Diaz, and I would like to talk about trauma, in particular sexual trauma. At the Mount Sinai Adolescent Health Center, we see young people that come for a number of services. And something that people may not be aware of is how common trauma is in the life of the young people that come to us. The young people that come to the Mount Sinai Adolescent Health Center, about 70% of them have significant trauma, sometimes complex chronic trauma. Our young people may have been traumatized by a history of childhood neglect, physical abuse, sexual abuse, incest, rape, teen dating violence, domestic violence. So we also see young people who are being sex trafficked. And there are other things that can be quite traumatic, like when you have community violence, when you are a victim of discrimination, whether it's racism or because of your gender or sexual orientation. So we work with a highly traumatized population. And it is very important when you work with traumatized population to understand and be aware of how common trauma is, the negative impact that trauma has in the victims, and what are those signs and symptoms that they present with. The Mount Sinai Adolescent Health Center is a trauma-informed center. Everything that we do is with that trauma lens, because we know how prevalent trauma is in the life of our young people. So just by having a team-friendly system where people are warm, welcoming, respect for the young person, feel connected, all those things are very important for a trauma victim, because they usually have been living in isolation with their history and what happened to them. So when you help them feel connected, when they know that they are not alone, that helps them also heal. It's extremely important. And more specifically, we actually do services for trauma. So we have the mental health staff, all are trained on doing trauma-focused cognitive behavioral therapy and many other modalities of therapy that work for this population. We provide individual therapy around the trauma. We do groups that are specific for the trauma. For example, we run groups for young people who are victims of incest. And the entire support group and psychotherapy group is about dealing with the trauma and how to heal and do that. We also know that especially if the trauma happened at home, you need to work with the entire family to understand what happened and help the family heal. And we need to have the staff to be very accessible to young people, to really be able to be rich when the young person needs to talk to someone because maybe something is coming up about the trauma, what happened to them as a child. They really need to feel that they are not alone. There's a place where they can come with whichever way they are feeling. They can call us, they can come in. And all that is part of the healing process for a young person with a trauma history. We also have lawyers. We have a part of our services are legal to help them with if there's any thing that they need a lawyer for. So we have legal services to do that. We are very involved in advocating on their behalf. For example, if they were raped in their school and they don't want to go back to that school because of what happened to them and the reminder of that, or because they are worried or afraid, we also help them. So if we need to talk to whether it's the police or child protection or anyone on their behalf, we help them with all those things. If they need to bring their parents to tell them or to disclose what happened to them, we say, bring your parents, we will sit down with you to help you disclose, because sometimes it's very hard for them to do this by themselves and they may be worried or they may not know how to do it. And in the safety of the clinic, the young person is able to do sometimes things that they will not be able to do on their own. At the Mount Sinai Adolescent Health Center, we are mandated reporters. So if we see a young person who's being abused, whether it's physical abuse or sexual abuse, we have to report that. We also provide confidential services. So the way we do it is that when the patient comes to us, and if the family comes with them, we tell everyone, here we provide confidential services, except if there is ongoing abuse or there is abuse, or if the life of the young person is in danger, like they are suicidal, or if they know that somebody else's life is in danger, like they know that a gang may be about to do something to somebody else, we cannot keep those things confidential. When the young person discloses that they are being, for example, sexually abused, we explain to them, because we said it before we took the history, that we have, if there's any issue of abuse, we need to call child protection. We need to be able to tell child protection about the abuse, and that in our clinic, we work closely with the mental health people, including the social workers, to be able to do that. Hi, my name is Angela Diaz, and I would like to talk about trauma, in particular sexual trauma. Sex trafficking usually happens when a young person is used by a third party to sexually for gains. It could be financial gains. And what happened with this is that a young person, and this is domestic, sex trafficking in the U.S. happens in every single state and the District of Columbia. Sometimes when people hear sex trafficking, they think about other countries or people being brought to the U.S. I'm talking about our own kids. Domestic sex trafficking happens all the time. And these young people are approached and groomed by traffickers. And then they could just be seeing the young person in the street and say, oh, you are so beautiful, and start talking with them and offer them to buy them a hamburger or something, and just start chatting with them. And eventually they may say, I want to be your boyfriend. And then when they try to develop that relationship, one day they will say, oh, if you really love me, you should have sex with my friend. And if the young person does it, then that continues to increase the different type of people that they are having sex with. And this person, this boyfriend, is being paid or is gaining has some gains from this interaction of the young person. You know, and sex trafficking can be through a trafficker. It could be through sometimes a gang, maybe involving sex trafficking. Sometimes it's an individual, sometimes it's a gang. Sometimes the families may be trafficking the young person and having gains such as money or drugs or something like that. There are a number of things that put young people at risk for sex traffic. The most immediate, the proximal risk to sex trafficking of young people in the U.S. is being homeless or having unstable home. Another risk is having a history of abuse, especially sexual abuse. Young people who are gay, lesbian, and transgender are at higher risk to be sex trafficked. Young people who are system involved, such as foster care or the criminal justice system, also are more likely to be sex trafficked. So these things are complex, but we need to understand that there are multiple risks. Some are individuals, some are family, some are community, some are more societal. But there are sometimes, because we ask them directly if they ever exchange sex, either for shelter, for money, for food, for drugs, we find out if they are engaging in any of those behaviors. Also, sometimes if you see a young person that comes to the clinic, sort of that is not dressed according to the temperature, for example, or they have certain tattoos in the neck that say that is girl, or something that sort of identify them as property of somebody else. You know, you sort of think that there is a possibility of that, and then you ask the young person directly. Something else to be very aware, sometimes the trafficker may come with the victim. And they want, when you are taking a history, you should always see any patient, any teenager should be always seeing at least for part of the history by themselves. But especially when you suspect that they are being sex trafficked. Because the trafficker tend to take over, they want to be giving all the history because they don't want the young person to say anything that may compromise them. So we always say to everyone, the way that we work here is that at some point we ask the parents or the friends, whoever comes with a young person, to wait outside, and we'll continue the conversation and do the physical exam. So we had that opportunity to work with the young person and ask any question that we may need to ask, and give the young person the opportunity to share anything that they need to share. But we know that they're not just going to pack up and leave. It's complex. They may be afraid of the trafficker. They may not know what to do, where to go. So we start that conversation, and we really encourage them to keep coming, and every time they come, we continue the conversation and continue to give them another dose of mental health. But they are not going to be able to live the life unless they have outside in the community connections, whether it's connection to family, they have a place to live, they have a place to, let's say, get money to eat, or, you know, they need to survive, they need to do that. So you need to start working with them as they prepare to live the life, to what system of care are they going to come to, what resources in the community are going to be available to them. And only after that, and sometimes it takes like 6 tries or more for them to try to leave, for them to then stay out and be able to get reconnected. They need to be reconnected to society and to the different elements of society. That is very important. So we provide these trauma-informed services to these young people who are being sex trafficked, but we also work with the different systems in their behalf. Sometimes they are brought by police, sometimes they are referred to us by court, as I said, the FBI, Homeland Security, and sometimes just other services. But we also are very involved in advocacy with many different groups in New York. People work together because these young people were not only being victimized in the trafficking, but they also were being arrested. they used to end up with a criminal record, and they used to be re-victimized by the different system. And after a lot of advocacy, New York actually changed the law, and now they see any young person as a victim rather than a criminal. A victim who needs services, who need to be connected, who need to really be helped. And this has been really, really important. This is key, because young people are much more likely now to even disclose, and they know that they can be helped. And we can work with the child welfare system, child protection, everyone, the different type of system to really help this young person do well, rather than consider them a criminal and making it harder for them to live the life. At the Mount Sinai Adolescent Health Center, we provide free services to the patient at no cost to them. On average, we spend about $1,000 per year for all those services that they receive. All those comprehensive services. We also buy their medication, and we give them Metro cards so that there is no barriers. And because only 30% of the teenagers that come to us, the young people that come to us, have Medicaid. If they have Medicaid, we bill Medicaid, but we have to raise a lot of money. So our budget for the year is $10 million. So we raise the money to be able to provide all the services that they need, integrated, and not worry about the fact that they do not have money or insurance. The Mount Sinai Adolescent Health Center has had a long history of partnering with schools, and we partner in different ways. One is that we have, within 6 high schools in Manhattan, we have full-time clinics. So right inside the school building, we have clinics where we provide medical, mental health, sexual health, so all the components. And we also can go to the classroom if the teacher requests that. So very strong working relationship with schools. We also have young people that we train to be leaders. We have a peer health education program that work in different types of schools in New York. And they go into the classroom and work with young people on an array of issues, including how to prevent HIV infection, how to make good decisions about trauma. And they go with the staff, and it's very effective because it's young people talking to young people. We also, many schools send young people to us. We feel that parents are really key. Young people have the right to confidential services, and we honor that, and that's very important to us. And that's why so many young people come. But we also understand that young people do much better when their parents love them, when their parents are involved in their care, when they can communicate with their parents. So we actually encourage parents to come and bring their children. We encourage young people to talk to their parents. And sometimes the young person may say to us, oh, we cannot say that to my mom or my dad. They will kill me. And we say, no, they will not kill you. Bring them here. We will help you tell them whatever the issue is. And the young person has that option to bring the parents to the clinic, and then we help them tell. But we really are major partners with parents. We also do family therapy. Usually the family therapy involves the adolescent that we serve, and also whoever is in their families. It could be a mom, it could be a dad, it could be both parents, it could be a grandparent, all the siblings. So we really think that family is very important. And the healthier the family is, the healthier the young person will be. We reach the most vulnerable and disconnected young people. And the reason that we are able to do that is because of the way we design our services. We make it easy for everyone to be able to come in. Public school, private school, and the specialized high schools. And the teachers and guidance counselors and other professionals in the schools send patients to us all the time, because they understand that a young person will be more ready to learn in school if their needs are met, whether they are physical needs or they are mental health needs. They know we will not judge them, whatever is happening in their life. We meet them where they are, We know, we come with plans and things like that, but we make sure that we meet their needs. What we have learned working with young people is that we need to ask them direct questions. And if we do, and we ask them in a sensitive way that they know we are there just to help them, they're like an open book and they will tell us. And what we do is when that before they even take the history of the staff, I explain that everything is confidential to the young person and their family. The family came with them. If a young person I would say something that they are using, I'll be asking you crack or whatever drug every single day or something. We ask those questions from everyone. If a young person say their father is having sex with them and got them pregnant, so it's not that we need to be able to anything from you, and that's why we're asking those questions. So just be aware and talk to the young person. We are going to be asking you lots of different type of questions, but we ask every single patient the same thing. It's just to make sure that those that have experienced those things really will be able to share that and then get help for that. You really need to strive for equity. You need to really give these young people the steps that they can climb to get to where they need to be. And the way you do that is by providing team-friendly services, youth-friendly services, and providing all the different trauma-informed services that they need, of mental health, everything, and working with them in a way that they heal from their trauma and they are able to deal with the different disparities. Another challenge that we face is the lack of awareness of the needs of young people in terms of the type of services that they need. People try to send them to a biomedical type of approach, and that just doesn't work. And the funding often doesn't incorporate prevention and really doing the type of work, the intensity of the work that is needed to address some of the disparities and to really achieve equity. And it is really important because the funding itself is silo. And at some point, it will be important to try to figure out how do we develop maybe a youth-specific funding mechanism that incorporates all the things that we see, because it's in the same kids that we are seeing all the things, but also that go from wellness to prevention, health education, risk reduction, and treatment. So the full range of scope that I think is needed, because these young people really can do very, very well. We need to really think about the social, political, economic context that leads to the disparities, and then figure out how to fix it so that people can really maximize their outcome and do well. Another issue is training. When people go to medical school or psychology school or nursing school or social work school, they are not necessarily learning how to work with young people. So training is a major issue. And just to give you the example in medicine, in adolescent medicine people, it's only like 800 of us. So there are about 26 programs in the country, and every program puts 1 or 2 people who graduate every year. So that is not enough that's not enough adolescent medicine people. There are wonderful pediatricians and family physicians, and actually the majority of youth are seen by those other disciplines, but even them, I think, need additional training. I think we all should be receiving training on how to work with young people. The administrators should be receiving training on how to set a program that are appropriate for young people, that is going to make it easy for them to come and utilize those services. The financial mechanism need to be rethought and maybe integrated the same way those services are being integrated. And I think with all these things, the system will be much more efficient and the outcomes will be much better. we use different lenses. One is a social justice lens. Another one is a positive youth development lens. We actually see the young people as full of promise. They have many assets. These young people are smart, they are creative, they're hardworking, and even when they have such challenging lives, they are really trying to do the right thing. Sometimes I work with patients that I wonder, how does this kid get out of bed? Much less go to school, much less help with the chores in the house. They work. They do really help people in, they volunteer. So they have tremendous assets. And we need to really we need to reframe young people and start seeing them by the positive assets that they have, use positive youth development principles, and deal with the issues and the challenges and address them. But really, this should be more about wellness, about how these young people maximize their potential.